First on our list, sprained ankles. A misstep, a twist, or a sudden shift can stretch or tear the ligaments in your ankle, resulting in a sprain. This injury often presents with pain, swelling, and sometimes an inability to bear weight on the affected foot. Rest, ice, compression, and elevation, known as the RICE protocol, usually does the trick. Severe cases, however, might require physical therapy or even surgery. Next up, we have tennis elbow, not exclusive to tennis players. This condition is a result of overusing the elbow's muscles and tendons, leading to pain and tenderness on the outside of the elbow. A combination of rest, physical therapy, and pain relievers typically helps manage this injury. Moving on to concussions, a type of traumatic brain injury caused by a blow, bump, or jolt to the head. Symptoms range from headaches, confusion, to loss of coordination. Immediate medical attention is crucial for concussions. The treatment usually involves rest and restricting activities that could potentially cause another concussion. The fourth injury we're exploring is shin splints, a common ailment among runners. Shin splints occur due to stress on the shin bone and the tissues connecting the muscles to the bones. Pain along the front of your lower leg is a telltale sign. Rest, ice, and over-the-counter pain relievers are often effective treatments. Halfway through our list, we encounter whiplash, a neck injury due to forceful, rapid back-and-forth movement of the neck, like the cracking of a whip. Symptoms include neck pain, stiffness, and headaches. Most people recover with rest and pain medication, though physical therapy may be necessary for some. Next, we have stress fractures, tiny cracks in a bone caused by repetitive force or overuse. Pain that intensifies with physical activity is a common symptom. Rest is key in healing stress fractures, along with pain relievers and possibly immobilization of the affected area. Seventh on our list is plantar fasciitis, inflammation of a thick band of tissue that runs across the bottom of your foot. This condition can cause stabbing pain, typically occurring with your first steps in the morning. Treatments can include physical therapy, night splints, and in some cases, surgery. Finally, we have rotator cuff injuries. These occur when the muscles or tendons that surround the shoulder joint are damaged or suffer from wear and tear. Symptoms include a dull ache deep in the shoulder. Treatments typically involve physical therapy, steroid injections, or surgery in severe cases. In conclusion, from sprained ankles to rotator cuff injuries, understanding the causes, symptoms, and treatments of these common injuries can empower you to take control of your health. Remember, professional medical advice is irreplaceable. If you're feeling pain or discomfort, don't hesitate to seek help from a healthcare provider. Stay safe, stay informed,